medical university of South Carolina was founded in 1824, and 200 years later, the institution is a powerful leader in healthcare here in the Low Country and beyond. Today, I talk one-on-one with Dr. David Cole and Dr. Pat Cawley of MUSC Health and the Medical University of South Carolina about this year's bicentennial celebration for the institution for this edition of Quintin's Close-Ups. And if you haven't already, subscribe to my YouTube channel and like Quintin's Close-Ups on Facebook. Dr. David Cole and Dr. Patrick Cawley, welcome back to Quintin's Close-Ups.
Glad to be here. Thanks for having us.
Oh, yeah. I'm bringing you back on Quintin's Close-Ups because obviously MUSC is celebrating its 200-year legacy of contributions, milestones, and firsts that MUSC faculty, leaders, students, and staff have made through the actual healthcare journey that you all had here in the United States and beyond. Let me ask you this, gentlemen. Then, now, next. Who is MUSC 200 years later?
Well, I think that the way to maybe define a continuum is that actually MUSC started out when it was established by a bunch of innovators. Physicians at that point in time felt there was a need, actually established the first medical school, one of the first in the United States and the first in the South. So, with the philosophy being to serve the community. So I would say with that sort of basis, I would say that although we've changed in many, many ways, our basic reason for being remains the same.
Dr. Cawley?
Well, as Dr. Cole said, in the beginning, it was all about trying to take care of patients. It was a bunch of physicians here in Charleston who want to do something different. And I think at our core, that's still who we are. We're just a little bigger than we were then. We're still innovators. We're still trying to do what's right for the community and the state. And that's who we are. Some things don't change in 200.
That's exactly right. And I know, gentlemen, as you just mentioned, Dr. Cawley, MUSC has grown from the time of its inception to right now. And obviously, Charleston, as you gentlemen know, is growing by the day. So how do you keep how does the hospital and the university grow with smart growth?
Well, I think that certainly growth is not just growth for the sake of growth. I know as a leader in this role, trying to be strategic and purposeful in terms of what we're doing. So to define sort of our mission and how do we hit with highest impact. So if you look across the growth, which has been dramatic over the last 5 to 6 years, the simple version is that for us to accomplish our tripartite mission, delivering on health, changing the future, educating the future, we can't accomplish that by just, standing pat in Charleston. What the common term that we use and say, which I know is true, is that we finally, after 200 years, realized and are acting on the fact that we're not the Medical University of Charleston. We're the Medical University of South Carolina. And so it's about, in many ways, time that we had the capability and wherewithal and partnership to start to deliver on in a high needs area, start to delivering on that promise. So that growth, if you look at through that lens, I think sort of best describes what we've been about and, what we're trying to do.
Dr. Cawley, and I'm sitting right down the street here from MUSC, but what exactly are the high needs right now in this community when it comes to healthcare?
Well, a couple of things. The one thing that MUSC excels at the most is what I call high specialty care. Those things that only MUSC does in the state. So things like pediatric cardiac surgery, certain kinds of cancer therapy, certain other kinds of things where MUSC is the only. So we try to keep our pulse on those things that the community needs. And our definition of community is statewide, as Dr. Cole pointed out. So we look at the state and we say, what does the state need? And where does the state need MUSC to stand up? So those are the main things. But at the same time, there's other things that we know people need that we might provide with others, like primary care. So there's a need in this community here in Charleston, as well as across the state, for primary care. We do some of that ourselves, and others we partner up to do that. So that's how we keep an eye on things. We keep an eye on things we know we can do all by ourselves, but then at the same time, as Dr. Cole pointed out, who do we need to partner up with to offer those services?
So let me ask you.
Maybe another. I'm
Yes,
sorry.
sir. Oh, yeah, go for it. Yes, sir.
Just a slightly different lens, philosophically. What are our sort of North Stars? Putting patients and families first. We strongly believe and do everything we can to enable best care is local. We do not need every patient in downtown Charleston. And so the being in communities, being part of communities, partnering in communities is the best way that we can start to, over time, longitudinally provide and change health outcomes and health, sort of the lack of health in communities. So it's not like, hey, we're here from the government, here to tell you what to do. It's like, here, we're here with you. What can we do together? How do we partner together to accomplish those sort of things? And oh, by the way, sometimes you do need to come to downtown Charleston to get your heart transplant, to get your, high-end care. And we need to have the connectivity and the capacity to be able to deliver on that element of our promise.
What connectivity and capability you all have right now?
Quintin, you cut out.
Oh, yeah, I'm so sorry about the wind back here. I'm so sorry, but that's a little windy out here. But where should that connectivity be in the next 5 to 10 years?
Okay.
Well, I mean, we as Dr. Cole pointed out, I mean, at all times we're looking across the state, and where do we need to focus on clinical care? Where do we need to focus on education? Where do we need to focus on research? We're constantly scanning out there and trying to figure out, what is that connectivity? Because what may be important today may be different 2 years from now. At the moment, on the clinical side, we're trying to focus on what does the state need. State needs two things: needs that only care I talked about, and it needs just some basic primary care. Those are things we're heavily focused on. On the education side, the number of people in the state needing healthcare continues to skyrocket for two reasons. Mainly because the population's getting older, and there's a lot of people moving into South Carolina. So on the education side, we're trying to educate some directly ourselves, some in partnership with others. All kinds of healthcare workers, nurses, nursing tech, surgery tech, radiology tech, and I could name 20 others. And then on the third part is the innovation and the research side. We're always looking out also, where do we need to go there? And, I'll just give you one example. This morning we had a discussion about something called cellular therapy. Cellular therapy is going to be a new way of, it exists today, but it's going to be even bigger in the next 5 years. So, what does MUSC need to do to make sure cellular therapy, as it develops, what do we need to do to make sure that all South Carolinians have access to this if they need it? So that's how it kind of changes all the time, and we're constantly looking across all those different areas in order to find the right connectivity.
Dr. Cole?
I think that Pat's talking in sort of very true everything he says in terms of topics, but there's whole fields and domains that we feel are really important to lean into, that are important for the citizens of the state of South Carolina, that we've been working hard to take, again, with partners, a leadership stance. And I'll give you a specific example: behavioral health, or lack thereof, in the state of South Carolina. Oh, by the way, in the nation, right? So we can't change the nation, but we've been working with legislative leadership, and specifically in Florence, is in one of our divisions, we have, with partners across the entire spectrum of care for behavioral health, we're building a whole new facility and the purpose is not about building something. It's about trying to address the problem, which is, first of all, a lack of access and a lack of continuity of care, specifically in patients who are in crisis and often are having horrible outcomes because of the lack of our ability to manage, prevent, and deliver on what we know can be provided to help in that space. So that's a topic that is broader than us. We can't solve alone, but I always tell our team, it's like, these sort of things, the reason we have to partner, we can help catalyze, we can enable, sometimes we can lead, but somehow we need to lean in to make a difference on things that are bigger than us. And by the way, behavioral health as a topic this is not some sort of business plan moneymaker. We're doing this because it's the right thing to do, and we're leaning into this because we know it's a high need. And I always say when we're talking with different groups and so forth, you don't have to look beyond your family or your group of friends to identify somebody who's, the system's failing in a horrible way. So those are the sort of things that we feel uniquely and by the way, one thing we have changed, we have grown over the last 200 years. We are the only comprehensive academic health system in the state of South Carolina. What that means is that we can deliver on all domains: outstanding healthcare, educating the future, and changing the future in healthcare. That's who we are. That's what we do. And so we differentiate ourselves from community health systems. We need outstanding community health systems, but we have different levels of mission and resource that if we align with communities and community health systems, we can help enable a different future.
And Dr. Cawley, he touched on it a little bit just a second ago, but when you step back and look from a 50,000 view, what exactly is the state of healthcare as we know it today?
Well, healthcare is one of those things that it's very personal for everybody. I mean, my healthcare is different than yours, different than Dave's, and at the end of the day, it's a very, very personal thing. So that's how you always have to think about this. It's people with real life issues. Sometimes we tend to think about it as a business or these big entities, but it's very personal. So I would say, what's the state of how people feel about healthcare? And I think right now in South Carolina, it's not everybody's getting the health care that they want, or they're getting the access that they need. And what MUSC is trying to do is step in and help as much as we can. So that's how we prefer to look at healthcare, from a very personal lens.
Yes, sir. Dr. Cole?
I think in many ways, health care, in simplest terms, the challenge that we're faced with is not actually delivering health care, but delivering health. And how we transition to accomplish that is the challenge, I think, that we're faced with. What that means is that we actually have to change the focus and redefine sort of what's of value. And again, we can't force somebody to be healthy, which gets to Pat's comment about sort of individual, personal, and so forth. But as a community and as a state and as a region, we have to lean into providing a healthy environment. We have to elevate each other to do that better. And as a healthcare system, to me, that's a transformational proposition. How do we actually lean into that and catalyze that in a way that's meaningful?
And what are those values within the healthcare system, Dr. Cole, that you hope that MUSC will help redefine in the next 5 to 10 years?
Well, we actually have, as an enterprise, we have 5 values, but I'm not sure that those reflect into redefining a community. Respect, collaboration, innovation, integrity, compassion. Those are our 5 values. So I guess first we need to, live those truly as an enterprise, and then help other people understand that's who we are. But I think in the last 5 to 7 years, we've been able to better deliver on trust across the state. People don't realize this. We're delivering healthcare in some form or manner in 46 out of 46 counties in the state of South Carolina. And just a specific topic when we keep talking about innovation, telehealth was transformational in terms of us successfully navigating, I'll use that term, COVID, right? But we brought that to the table. We partnered on that. We delivered, across the state. We performed, I would say, and filled many gaps that were very real. Why? Because that's our mission.
Two last questions for you, gentlemen. First, Dr. Cawley, what were those gaps that you all filled, for instance, with telehealth?
Well, the biggest gap for telehealth is getting care into more rural areas. That's the most important. That's why telehealth got started. So for those people that come from part of the state that is very rural, they don't have access to doctors and nurses. That's the biggest gap. Sometimes that gap is people may not come from even a rural area, but they don't have a good transportation. So, I mean, this could be somebody up in North Charleston who doesn't have good, solid transportation to get to a doctor or nurse visit. So telehealth fills that gap as well. And maybe the last gap is that it helps. Sometimes telehealth does things that maybe in a better way than an in-person visit. Probably the best example of that are what we call telepsychiatry or telemental health, right? Where people do their psychiatry or mental health appointments via telehealth. And believe it or not, that's actually more effective. People are more likely to show up. They're more likely to follow through if they do it through telehealth. Mainly because there's a little bit of a stigma with mental health or psychiatry appointments, and people don't feel the stigma as much through the tele visit. So those are the three areas that we try to get at constantly when it comes to telehealth.
I kept thinking about this as I was preparing for this interview over the past couple of days. But we know, and COVID, obviously took place, I believe, 4 years ago, from when I look back to right now. But how exactly did that pandemic change the medical university health system?
Well, I would answer. Go ahead, Pat. Yeah, you probably got a long response.
Well, what I was going to say was, there are some hospitals and health systems that struggled during COVID, and there were other hospitals and health systems that really stepped into it. And I would put MUSC definitely in that second category. We stepped into it almost right from the beginning. Dr. Cole and I remember us being on phone calls, working through the weekend and working the phones throughout the entire state. Things like testing, things like vaccinations, helping smaller hospitals deal with certain parts of COVID. So we stepped hard into it. At the same time, we tried to be very disciplined about how we were running the hospitals and making sure that we wouldn't end up in financial trouble, which we did not. So in a lot of ways, MUSC came out of COVID stronger than we went into it. And I'm proud of the team that you're talking hundreds of people were involved in making that happen. And I'm glad to be on the other side of it. But it was tough during that, but MUSC persevered and came out better in the end.
I would echo
Yes,
everything that Pat said.
Yes, sir.
The only thing I would add about how it changed us, I would say that it transformed how we viewed ourselves in terms of what we could accomplish. And I would also say that I think it transformed how others viewed us, across the state in terms of what we're capable of and who we are.
How does the outside world, and really here in South Carolina, how do they actually view the medical university of South Carolina these days?
Well, I think we're highly respected in terms of who we are and what we deliver on, and I think if you look across the nation, I think we would be considered a rising star.
Where do you all go from here next?
Well, there's so many transformational possibilities. I would say we're just getting started. Whole nother topic: artificial intelligence and medicine. That's a transformational impact, right? There's down and upside on those sort of things. We have to mature into where we've grown, and to be able to to meet the opportunity and the expectations in terms of impacting healthcare. We're in discussions with our strategic plan, and I will share with you one aspirational goal that we're landing on is that in the next 20 years, the state of South Carolina will be in the top 20 in terms of healthcare outcomes. It's a huge goal, and it's not an MUSC only goal, right? But we're excited about the opportunity to lean into that.
That's really amazing. Well, you all do a great job. I was born at MUSC in 1984, so I know all the great things that you all done for this community and beyond. So thank you for that. But Dr. David Cole and Dr. Pat Cawley of MUSC and the Medical University of South Carolina, thank you for your time. And again, welcome back to Quintin's Close-Ups.
All right. Take care.
Thank you all. Likewise.